I'm SHAPNAM ARZEENAA, doing a clinical fellowship in contact lens dispensing. Today I'm going to show you a video on contact lens insertion and removal and post-fit evaluation. So now I'm going to do a hand washing technique. After hand washing, we have to dry our hands using a tissue paper. So now I'm going to open the blister pack of the contact lens. We have to take the contact lens in our hands. So after this, we have to wash the contact lens using the solution. Do in a circular motion. So after rinsing the contact lens, we have to do the taco test. It is to check the contact lens is in the position or not. After this, we have to place in our fingertip to check the shape of the contact lens, whether we have fitting it in the correct position into the eyes or not. It should be, the edges should face the inner side of the contact lens. So now we have to lift the upper lid of the patient using our fingers. So you have to ask the patient to look down and insert the contact lens. Look up, right, left, up, down, and ask the patient to slowly close the lids. Ask the patient to look in all the primary gaze. Close your eyes, look up, close your eyes, look up, down, rotate your eyes. First, we have to check the evolution, post-fit evolution. First, we have to check the centration. So look straight. The contact lens is covering 1 mm of the cornea above the limbus. Then we have to check the movement of the contact lens. Look up, down, right, left, up. So now the contact lens is moving in a correct position. Now we have to do the push-up test to check the fit of the contact lens, whether it is steep or flat. So for that we have to use our thumb and give pressure to the lower lid. If the contact lens is not moving, then the fit is called steep. The contact lens is moving very fast, means fast riding, then it is flat fit. Now it is in an optimal position. So now I'm going to remove the contact lenses. We have to hold the lids and ask the patient to look up and drag the contact lenses down and pinch using our finger. After removing the contact lenses, we have to rinse the contact lenses again before placing into the case. Do in a circular motion. After that, we have to place this in a case using a sufficient solution to soak the contact lenses.